Okay, good day, our pregnant mothers. My name is Dr. Edwin Okolo. I've come to discuss with you on obstetric health issues. And today's topic we are going to take on is urinary tract infection in pregnancy, UTI in pregnancy. Um, Before I go on this issue, there are a lot of concerns for our pregnant women. Most of them commonly call it toilet infection, but the infection is not solely from toilet, actually from our human body. Uh, what is urinary tract infection? And at the end of this discussion, what causes it? When a woman has urinary tract infection, UTI, what are those symptoms woman should be having? Then, if man, the myth of the whole thing that how do we actually prevent it? Because it said that out of every two women, one has UTI in pregnancy, which will obviously manifest. But out of these two, out of these two in pregnancy, then every 10 women, out of them have urinary tract infection in pregnancy. But that will not show that it's asymptomatic. So before then, why should a woman have UTI in pregnancy? What the problem UTI can lead in pregnancy? These are what we are going to look at now. Then how do you prevent? The meat of the whole discussion is prevention of UTI in pregnancy. Then UTI, urinary tract infection in pregnancy, what causes it? UTI in pregnancy is mainly due to, I just use layman's term. I will not use a lot of medical language. I'll come to your own level of understanding. It's called what is germ. Germ are just like small microorganisms you cannot see with your naked eyes. So, and they are the main cause of urinary tract infection in pregnancy. Those germs, there are many types of them, not only one, but the common one is E. coli, then chlamydia, and gonorrhea, and other ones. But I'm not going to go into detail in them. At front to use mainly on how you contact it, how do you take care of yourself, and how you can manage yourself when you have urinary tract infection in pregnancy. Urinary tract infection in pregnancy mainly affects urinary tract, that is the bladder. When it affects the bladder, called cystitis. When it affects the vagina, called vaginitis. When it causes urethra, that's the mouth of the bladder, called urethritis. When it affects the kidney, called nephritis, or when affecting the pyelonephritis. So today we are going to discuss about all these infection of pregnant mothers in pregnancy. Who are people who are prone to having urinary tract infection in pregnancy? Mainly the very young women and the very old women. When I mean very young, so women have from 18 years or 20 years above, down. Then for the very elderly one or old one from 35 years up who are pregnant. But looking at this discussion, it's not only affecting the pregnant mothers, it can also affect the non-pregnant women or mothers, because when a woman is affected with urinary tract infection before she gets pregnant, it can prolong until when she gets pregnant at the end to affect her pregnancy. So apart from this very young and very old people who can contact it easily, the other patients who are prone to having UTI in pregnancy, they are people that have diabetes in pregnancy. Diabetic patients are easily prone to having UTI in pregnancy. Also, sickle cell disease patients, people who are sicklers, they are prone to having urinary tract infection in pregnancy. So that is it. Then let's look at the symptoms or what the patient can complain to when she has UTI in pregnancy. Such symptoms include itching or scratching of the genital tract, like the vagina. Some women when they have UTI in pregnancy, they have itching from their private part. Say that the private part of vagina is itching, is scratching there and itching. What most people may call it just like genital tract or vulvar itching. Then apart from this itching, then their body sensation Do you have burning sensation in their vagina and up to other parts of the urinary tract? Burning sensation that as they feel like urinating, when we want to urinate, they have burning sensation like peppery sensation within their urinary tract. That's why when they want to urinate, they will feel pain as if they pour pepper or hot water inside their vagina. Then feeling the urge to go and urinate more than usual. Usually, they almost start anytime they want to feel like going to urinate, and every moment, maybe within few minutes, they feel like going to urinate. Even though they are staying at a convenient place, they must go and urinate because they have irritation of the bladder. So with that, they always feel them frequenting the convenience. Then apart from feeling the urge to urinate, before they even reach where they are going to urinate, that the convenient already urinated on their cloth. Apart from this, they can urinate more than normal number of times. Apart from urinating normal number of times, when they urinate, they will not be able to empty their bladder completely. And when they come back, they feel that their bladder is still full. They go back to urinate again. That's called frequency urgency. And at night, what we call nocturia, they urinate more than one time at night. So these are some of the symptoms. Another symptom they could have is that they feel that their bladder is full. Their bladder is full, that even after urination, as I already mentioned it, then whenever they go to urinate, as they urinate, if you look at their urine, normal, I'm going to say that urine is colorless. But with these people that are UTI and pregnancy that have it, when they urinate, you see that their urine is cloudy, or they like Coca-Cola colored. Apart from being cloudy, it's usually smelling and foamy, like a lot of foam in it. That's evidence that there's something wrong with the urine, and not a normal urine. Then another thing they can have, that they have pain above the lower part of the abdomen. It's called lower abdominal pain. They have it, and this pain is just like can be aching and dragging in nature, as if the person is in labor. Over time, the pain, because of the spread of the infection from the bladder, it goes to the ureter to the kidney, and that time the pain will start narrating to the back, which means apart from having lower abdominal wall pain, they also having lower back pain. That's evidence that the infection has progressed to chronic condition. Then another thing they have is high fever. They're having high fever. Their body will be very hot. They're having high temperature, up to 38 degrees centigrade or more. About that. Then some of them having they feel like vomiting. They don't vomit. Some of them like feel like vomiting, nausea. When they have for nausea, they start vomiting because of the irritation of the system. Then I think I mentioned before vaginal discharge. Some of them have creamy vaginal discharge or whitish vaginal discharge, or having mixed with blood, depending on the extent of the infection. So these are the symptoms most of them will have, or most of the patients that have UTI in pregnancy will have. Then another thing is that when the patient has this kind of infection, what does the patient do? What the patient do to prevent this infection? Then if probably first thing a patient will have is that when you have any symptoms of this UTI pregnancy, first part of call is to go and visit a doctor. I mean a doctor or a health personnel that is skilled or well qualified to treat you. This is why we are thinking that we should avoid you, a pregnant woman. Please don't go to a nearby chemist. Don't go to nearby maybe maternity home, because you may think that it's just an ordinary infection. You may have gone chronic stage that you don't just treat chemist in medicine to treat it, or maternity is medication to treat it. But I say first of all to a hospital where the doctor will look at you, ask you some questions concerning their complaint. From the question, after asking question, then the doctor will going to examine you, then send you for investigation, can use blood or urine to investigate you. At the end, he has to treat you properly. How is he going to treat you with injection or tablet, depending on the extent of the infection. Then, and this is not the patient that just stated I treated for 1 week or less than that, and it's okay. No, you must first of all have that treatment for at least 10 days at most, or more, about 14 days, that is 2 weeks. because of nature of the infection, to make sure the infection is properly cleared out of your system. Then after you have done that, then you want to talk of what this thing can cause in your body, who can it affect, because it's going to affect both your baby and yourself. Let us look at how can you prevent urinary tract infection in pregnancy. Then apart from preventing it, then what are those things that we do that our life pattern or behavioral habit that make us to have urinary tract infection in pregnancy? Looking at the whole scenario, UTI in pregnancy can be gotten in many ways. First person. So you must deliver at a place that is very close to you, that you can easily reach when the labor sets in. Please, I want to warn you that, or advise you, please don't go and register at a maternity or primary health care center. Even if you want to just initiate, but don't aim to deliver there, because have complications. A person at primary health care center, there may not be doctor there or skilled birth attendants, which means complication may arise which they cannot be able to attend very well. So please try and register in a facility that have skilled birth attendant or doctors. Apart from that, then know that in that aspect of the place where you're going to deliver, make sure that as you reach there, know the name of doctors or nurses and try to get close to them. But as you are free to choose any doctor or nurse that will be around day of your delivery, so that especially maybe you notice that you are in labor, you can even call them on phone that you are coming and they wait for you and take your delivery. That is privilege they give to you as pregnant mothers when you are in labor. Then apart from that, you have to have their own phone number. Have the phone number of the hospital. In case for any reason you are even far away from your house or where you're supposed to come from when you are in labor, they can call them that you are in labor and you are coming, so they should get ready to receive you immediately you are coming into the facility to deliver. Then another thing that I also want to emphasize on issue of going to traditional birth attendants, that yes, these people are good, that we are trained well, they are trained, but some of them are not well trained properly to take delivery. And the issue of like someone that has done operation before, CS section to deliver before, operation, this is not delivery you go to take in TBA a place. No, don't try it, because unless you want to just jeopardize, endanger yourself and your baby. And also, if you've done operation before to deliver, please don't go to primary health care center to register for antenatal. No, go to say to a tertiary health institution facility where you can deliver, or secondary health institution where you have doctors where you can deliver. Please avoid the primary health care center or going to tertiary birth attendants. Don't do that. Our aim is that at the end of the 9 months, we see you with your baby, live baby, and you the happy mother. That's what I'm going to let you know now. Then next thing about preparation and complication readiness, you must not do something that will jeopardize your chances of being happy at the end of the delivery. What do I mean? You have to know the people who are living with you, your neighbors or your husband. They are going to go into labor. Who is going to take care of? Who will take you to hospital where you are going to deliver? Even if you have maybe you have family vehicle, you're not going to drive. Because pain of labor and co will not even allow you to properly drive. So I advise that you are getting time for you to deliver. You must make arrangement for transportation. We're going to transport you. Is it your husband or your neighbor in case your husband is around? So you must find somebody as per driver who's going to drive you. Make arrangement for transport to take you to the hospital. I'm going to deliver so that you say you could not go to you deliver on the way, or you could not get to the hospital before you deliver. You deliver. Then be in good terms with your neighbor, because the day you are going to deliver, maybe your husband will not be at home, your driver will not be at home, but maybe those your neighbors who are staying with you in the same yard or the same facility where you are living are the ones that are going to my sister, don't worry, they will help you, take you, carry your delivery items, then carry you, take you to the hospital. But you are the one that's not in good terms with them. That day they look at you and go their way. You will be stranded. No person will look at you, tell you to get to the hospital. That's another thing. The next thing that probably those of you that already have some children at home, they are going to deliver. Probably maybe spend about 24 hours at a day or 2 days when you are in facility where you are going to deliver. Then those children are going to leave behind where you are going to deliver. Who going to take care of them? Is it your husband? Is it your neighbors? This is what you do, make arrangement, because number one, some of them may still be already going to school. While you are in the hospital, we are in the hospital trying to deliver, or you deliver, trying to get yourself back. Who will take them to school? Who will feed them? If your husband not the kind that can properly take care of children, then mean that your neighbors have to come in. So this aspect, if you do that, have some neighbors who will take care of your children when you are going to deliver. The neighbor can be maybe call your sisters, or your neighbor or your husband. So you must teach your husband to how to take care of children when you are not around, or when you are in the hospital while trying to deliver. That's what you are going to do. So that not when you come back start hearing stories that this is my child, she or he was not taken care of, could not go to school, or fell sick because no person fed him or her, or another story. So that's what I want you to let you know at this stage. Then another thing is that in the hospital, where you are living is the road about transport, the road accessible to the hospital area where you register. So make sure that the road to the hospital where you are going to deliver is accessible, so that even if labor start in the midnight or in the night or daytime, you able to access yourself or carry yourself to the place where you are going to deliver. Then another thing is blood transfusion. This is very important. Among all things I'm saying, all of them are important, but this is utmostly important. You must make arrangement for blood. I say that blood transfusion is donating blood is very important when you are pregnant. Why is it important? Because we don't know how the pregnancy is going to end until you have until you have delivered. Even some hours after you have delivered, the first 1 hour or so, even first 2 days after you have delivered, we're not sure. Look, there are no complications at a certain extent. So some women may deliver your normal vaginal delivery, no problem. They just use minimal amount of blood. But some women may end up in the cesarean section. If some women may deliver, they will not be able to deliver. Their placenta will be returned. That's if you have to manually remove the placenta. That's as per other thing. Maybe uterus womb may rupture. Other thing may happen that need without you being transfused immediately. You may need 1 pint of blood, and more than 1 pint of blood, depending on the nature of the bleeding, postpartum hemorrhage. So make sure that you have blood available, at least 1 pint of blood, so that if your needs arises, you can start with what 1 pint. You can make arrangement for many pints of blood that you actually needed. So blood donation is very important. Arrange for blood to be available when you want to deliver. Don't say, hey, last time I delivered, no problem, deliver normally. No, don't think that, because no two pregnancies are the same thing. And no two pregnant women are the same thing. Your own may end in another way, different from what your neighbor's own or your sister's own ended, or what your mother's own ended. No. So you have to be prepared. Birth preparation, you have to be in your utmost. Then complication readiness, when problem arises, you're able to take care of those complications as you deliver. So that's what we are discussing at this stage of complication readiness, birth preparedness. And I want to emphasize more, as I earlier said, that so most women who are getting pregnant for the first time, some of them don't even go to register on time. They say because they don't have experience, they will just wait until when you are up to 6-7 months, they will go and register. It's not advisable. Please make sure you go and register on time, so that from that initial time, skilled birth attendant or doctor will start following you up till you deliver. Then what they are told to do in the hospital as for our good health, do it, don't hesitate. Then some women are even have already had many children. They have been called multigravida. Those who are already pregnant, they already have many children before, called multigravida. Some of them mean that I have experience. After all, the last time I delivered maybe at my backyard, or even in the house, or even in the farm, or even in the church, something like that. It doesn't matter. No, as I said earlier on, no two pregnancies are the same thing. No two women have the same destination as per delivery. So in that aspect, you that I've delivered before, please make sure you register in a health facility. And also, for foremost, if you deliver before through operation, please don't take chances. Don't say, let me go and deliver in a TBA place or maternity home or private health care center. No, don't do it, because you end up with uterine rupture. You may end up with retained placenta. You may end up with anything that can affect both you and your baby. You may end up prolonged labor or entrapment or any part of the baby while trying to negotiate your birth canal and come out. Please, my advice is, please don't do it. Don't gamble with your life. Remember that pregnancy is a 9-month project and it's not an emergency. So for you to end that project, you must be ready. Let me chip in on the issue of you and your partners or support. I'll say that pregnancy is you, the pregnant woman, you are the driver. Who are you driving? You are driving the baby. The baby is your passenger, or the babies are your passengers. But who is your conductor or your assistant is your husband. So if anything happens, it is you that the driver and the passenger, you are affected directly. The conductor, this is your spouse or your supporters, they are just by the side. They will not feel it. It's you that feel it. So know that this project is you, taken by you. Meaning that two people who are involved in deciding in bringing about the project, but one person carries out the project, that is you, and the project is your baby. Please take good care of yourself and your baby. And I believe that as you do so, you will not have any issue at the end of the delivery process. You go home with a life healthy baby, and you will also be healthy, happy with your family. Thank you for listening to me at this moment. I want you to, at this moment, I know they have many concerns or many questions that are bugging your mind. I want to forward. Please drop your questions. I'll answer them as soon as possible. Once more again, thanks very much for giving me your time and listening to me.